My name's Jay. I'm a surgeon training in the UK. I have been a part of thousands of surgical procedures. I have looked after tens of thousands of patients before, during and after their operations. I've seen people at their highest, I've seen people at their absolute lowest. And tomorrow is my biggest challenge. I'm going to be going under the knife and having open heart surgery. So I want to film part of my process. I want to film my experience and share that to see if I can demystify surgery, the hospital, the recovery process, and if I can help some people who are going under surgery of their own. That would be brilliant.
So this is me as a tiny baby in Great Ormond Street. I was born with critical pulmonary stenosis, and without immediate surgical intervention, I would have died. So I was rushed to Great Ormond Street, one of my favourite places. So on this model of a heart, this is the pulmonary valve at the top. The blood with no oxygen in passes from the right side of the heart through this on the way to the lungs. It closes to stop the blood coming back into the heart, but mine was more or less stuck in the closed position, making the heart work really hard to push the blood through. I had a procedure to dilate it, and now it's kind of stuck open, allowing all the blood to flow back. This right side's meant to be substantially smaller than the left side. It deals with much lower pressures. The lungs are much closer than your toes and your brain are. Which is where this side pushes the blood to. So this side should be so much smaller than this one, but mine is bigger, it's thicker, it's more muscular because it's struggling to cope without this valve, and that's only going to get worse over time. My fitness and my health is only going to get worse unless this valve gets replaced. I'm certainly no stranger to the hospital. I've had yearly investigations with fitness tests, MRIs, echoes, blood tests, ECGs, but during the pre-op assessment I've had regular urine and skin tests for bacteria, lots of blood tests, all in the aim to get me prepared for surgery. The benefit I have is that I've known this was coming for a long time.
Sorry. No, don't. I was thinking of making a documentary to kind of show people what it's like to go through it from a point, because I kind of see it from both sides.
Yeah, no, you're on the other side too. Are you feeling okay, lightheaded or anything?
No, not at all.
Okay, deep breath in. Blow. Okay, keep it going, keep squeezing and pushing all the way out. You're almost empty, a few more seconds. Squeeze, squeeze. Okay, big deep breath in.
After more skin and urine tests, more blood tests, we could finally start thinking about what kind of valve we need in place. On the left here you see a mechanical, kind of a manufactured valve. On the right side, this is a valve that's dried out, but it's made of animal tissue and some artificial material as well. So this mechanical valve, the two leaflets there act the way your normal valve does. They open when blood pressure increases to push through, and then close to stop it going back into the heart. The benefit of the animal tissue one is that you don't need to be on blood thinners, unlike the mechanical one, because if those two leaflets get clot on them, then you become very unwell or die. So we've opted for a third option, which is a human tissue valve. This will come from a dead person, but it will last a lot longer. So, wish me luck.